they're still here, most of them. They're still living.
Mm-hmm.
Yeah, most of them are still living. The ones that are gone are the ones who came late and didn't follow the rules.
Mm. Yeah.
What I found over the years is that persons would wait until no one else can help them before we get them. And most of the time, it's too late. You know, cancer would have metastasized and would have, excuse me.
Mm-hmm. You okay? You lost your voice.
I did the wrong thing.
Huh?
Had some cashew nuts before I did the program.
Oh. That should be the next. That should be the next topic we talk about.
Better because you really shouldn't use nuts before a program, before you sing, before you get on television. But I was working with my last patient not too long ago, and I just felt like I want to snack on something, so I took some cashew nuts.
Wow!
That, you know what? Today's the program. You really shouldn't have had any nuts. Anyhow, most of the persons who we would have not helped to succeed overcoming the cancer situation are the rules. They don't want to make the sacrifices. They want to make the changes, and sometimes people can't afford the treatment. Plain and simple.
Mm-hmm.
Sometimes we would help them in many ways because we know how it is financially in the lives of many. But you know, we have to purchase the medicines too, and then we have to pay the shipping and the duty and everything, and it adds up at some point. You know, it becomes a situation where, you know, we have to kind of monitor things a little more. But I wanted to hear from you regarding your views and what you may have to say in opening comments on cancer, because I know you do a lot of studies and you like to do a lot of research, and you spend some time doing all sorts of things. You did even did some autopsies on people. I remember we talked about this at one time. I remember at one time when you were doing the autopsies that you sent me the images of someone who had died some time ago to show me the effects that smoking has on a person and bad diet. You probably can't remember that.
Yeah,
years ago.
Wow.
But you know, it only confirmed what we believe, that number one, improper diets can lead to the formation of cancer cells and the aggressiveness of the cancer, parasites, chemicals, all sorts of factors. But I wanted to hear from you so we can get into it a little more, since we don't have the kind of time that we normally have. We started.
We have a short time.
Yeah. So.
Yeah. Well, a lot of things, you know, with cancer, as we had done before, we looked at not just you read the textbooks, especially the pathology or pathophysiology, and a lot of information. They do have a lot of new information. They found out that certain genes are related with cancer, especially breast cancer and other cancers. But many a times they will tell you that they really don't know why. Right?
Yeah.
You don't know why, even though we have a lot of information, but yet still, we're not really able to pinpoint or put a finger on the real cause of what's causing cancer. But cancer's been around since I mean, 3,000 BC.
Wow.
Been around a long time. I mean, they've looked at this abnormal growth, and they've always been trying to figure out exactly why are the cells not growing ordinarily. Why are they more, uh, they're not in any particular uh, format. When they're just belligerent, they're just growing any which way they want to and rapidly without any order. And that's what they're finding out, is that certain genes are able to regulate the growth of cells. As we know, we talked about this before, the DNA, we have DNA, and the DNA is really what's in charge of, controlling the genetic material of what cells are produced and how they're produced and so forth. But there are certain genes that they've placed their finger on today. I know, the BRCA gene and the HER2, HER1 gene, the BRCA1, BRCA2. These are genes that, with the BRCA1, BRCA2, these particular genes, they are able to regulate, they call tumor suppressor genes. Mm-hmm. So when the cells are not, growing as they should, and they're belligerent, they're just growing any which way, these tumor suppressor genes kicks in and figure out, hey, there's a tumor growth happening, and the cells are not functioning like they should. So that tumor suppressor gene just suppresses the growth of the cell and prevent the tumor from forming. However, what they found out is that a lot of individuals don't have these genes. The genes themselves, the BRCA1 and BRCA2 genes, for example, they are, in some people, they're absent.
Mm-hmm.
Okay? Because those genes are regulators. They're regulating the cells from growing. So when they're absent in certain individuals, then once the cells they're producing.
There's nothing to stop them.
There's nothing to stop it. Yeah. Exactly. As BRCA1 and BRCA2. And with the HER1 and HER2 genes, these are just the new genes that they found out. They find that these particular genes are able to stop, or actually, when you have those particular genes, it's the opposite thing. They're able to manufacture a lot more cells, tumor cells, and they're not able to regulate it. So these two markers, when you go to get a test today, they're looking, especially with breast cancer, they're looking for those two markers. If one is there and one is absent, then you have a problem. In either way. So it's been around for a while, and that's the scientific aspect of it. And the other part of it is, and that's the research aspect of it. The other part of it you hit on, and what they really found out, especially with the China study, is that even though you may have those genes present, it doesn't necessarily mean that you can develop cancer. And there's other things that come into play, like you said, the first one is diet. Mm-hmm. Okay. The other ones are other environmental factors. Mm-hmm. And the other thing is your lifestyle. There are three things.
Yeah. But then there's another factor that is that I found over the years in my research: parasites.
Yes, and that's the other thing too. And that would go on with under the
dietary side.
Yeah. Parasites do cause cancers, and worms do cause cancers. Mm-hmm. Mm-hmm. And other things, bacteria do cause cancer. Mm-hmm. So
when you think of it with the worms, and we find, like the other day I was screening someone, and we found over 12 different worms in that one person, actively living in one time in that person. Okay. Now these worms are notorious for creating bacteria in your system. They defecate in you, they multiply, they eat, they mess. So it is obvious that if you've got organisms that are living in you, that are eating from you, messing in you, multiplying in you, that chances are you could have some serious infestations. And sometimes what I found also is that when we see tumors in persons, it is not necessarily a tumor that is there. It is a nest of worms.
Yeah. Yeah. Mm-hmm.
You know, so worms, they play a big role in not only cancer but in many other factors. But they're notorious for contributing to cancer.
Mm-hmm.
People underestimate the worms, and they say, oh, adults don't get worms, all sorts of things. But adults get more worms than children.
It's true, and that's the dietary aspect of it. If
Yeah.
you eat, and I tell them and I show them, I can always tell, based on what I'm seeing, what the individual is consuming.
Yes. Yeah.
If a lot of times I see the worms, specific worms, and they did 3 different types. That if I am screening somebody and I'm running in, it's like almost every place you go, you start with the stomach, you go to the small intestines, you go to even the pancreas, and you're seeing there's a consistent team.
Yeah.
The same individuals are showing up even in the colon. And then you leave the colon, and then you go to the liver, and they're there.
They're there. Yeah.
So when I see that, then and all the other things that related. Sometimes people have problems, they have pains, they have this, they have that, And I would show them. I said, well, I go back and say, well, this is the problem you've been having, and these are the 3. Look at these 3 individual right here. Look, I'm going to different organs. Look. Do you see them here? Yes, I do.
Keep
you see them there? Yes, I do. You see that everywhere I go. So, and when I get to the organ, and when I run the test and I show them, they're like, "Oh my goodness," Yeah. So when I see that, I can tell them you eating a lot of fish and seafoods.
Yes.
Sure enough, that's all I eat. But I'm told fish is good for me, and so I'm eating the fish.
Yeah.
But, it's a double whammy. What the fish does, it causes Helicobacter pylori. That's number 1. You can you run the risk of getting stomach cancer, pancreatic cancer.
Salmonella.
Yeah, and salmonella too is there. Then that's the fish. Now the fish got worms too.
Oh yeah,
you can get lots of them. You can get tumor of the liver. You can get lots of tumors of the liver, colon. Wherever the worms. And the worms, they go wherever they want to go.
Well, I have this theory which I'm still researching. When we talk about the cancer spread, you say, the cancer spread to my colon, it spread to my
metastasis.
Now, we have to also understand, and we're doing some educating today, and I hope that people are listening and they're following. We have to understand that our body system is a system that is designed to actually heal itself. Designed to heal itself. The body system also has the ability to eliminate matter. It is designed that way. But if we continue to eat the foods and to do the things that causes us to accumulate the waste matter, then we're not really helping ourselves. Like I would say to people, you cannot keep doing the same thing that's getting you sick and expect to get better. It doesn't work. You cannot keep eating and drinking the same things that take you to the point where you have this cancer now and expect that the cancer will go. It's not going to work. So we're looking back also at what else contributes to these cancers. People don't also link chemicals to cancer.
Right.
Chemicals and metals. We got chemicals that we eat in our foods every day. We got metals that we get from different things like lead from filling and all of that.
Yeah, heavy metal.
Mercury from fish and seafood. We get cadmium from smoke, all the barbecue chicken and barbecue, whatever. And cadmium from smoke. And cadmium from other sources too. So all of these things that I just mentioned contribute to cancer.
Yeah, a lot of them do. And people, like the lifestyle, when you mention some of those things, and they will tell you, yeah, I do that, or I have that, I'm guilty, you know, and there's a consequence for everything,
There is.
and there's a cause and effect.
There is, exactly. I was going to say that. Nothing happens without a cause.
Yeah.
So when you go to your oncologist, or even when you come to us, and cancers are detected, um, sometimes people are alarmed. Really, really. But the other thing is that we have cancer cells that are actually in our systems
Mhm.
all the time. The cells
Yeah.
live there. You know,
Every day.
but the
Every
thing
day
is,
they
you
manufacture them
talked
every day.
earlier. You talked earlier about the defense mechanisms.
Right. Right.
I am
Hmm.
of the opinion that most persons who are afflicted with cancer, and those cells begin to multiply,
Hmm.
have developed also a weakened immune system.
Yeah.
An immune system that is now not able to overcome, or to contribute to the repairing, or the destroying, or the destruction of those bad cells, those rogue cells. And I would use the example of a football game, soccer game or a football game. You have the goalie there,
Hmm.
and he's there to ward off the ball from getting into the nets. The guys who stand in front of him are the defensive players.
Yeah.
They're the ones to stop the ball from getting to him to go into the net. You see, so if you take away the defense,
Hmm.
all you've got is the net. And most times when you get there, when you go past the defense and you get in front of the
Goal.
net, you score a goal.
You can walk with the ball.
It's raining goals because you have no defense.
Yeah.
So I equal that to the same situation with our bodies.
Hmm.
If your defense mechanism is weak, then you're opened, or you've opened yourself to a host of diseases, including cancer. Cancer, in my opinion, cancer doesn't start in one place. It doesn't. If you have breast cancer, it doesn't mean that the cancer started in the breast. It doesn't mean that. That cancer would have started those cells would have actually clustered in the breast because they came from somewhere. And they found that nice, soft, comfortable spot there, and they just develop. And you don't have your defense as you should have. And guess what? You can't destroy them. You can't save yourself.
Yeah, because the immune system is weak.
It's weakened.
And the lymphocytes and all the defense mechanisms, tumor suppressor genes and all these different things, they're not up to the speed. So once you're left exposed like that, um, that's it.
Exactly.
And
Exactly.
and that seemed to be um, the scenario that's really playing out with a lot of people, especially people with COVID.
Yeah, that's
Um,
another thing. We haven't even touched on that. I want to ask the guys in the studio to put the number of the clinic up there, because persons are asking for the number, and they can put the number to the clinic, 231-6477. They can put it up there so that persons can get in touch with us at the clinic there. But we haven't really, what I found getting to COVID, since you mentioned it, I found recently that more persons are being afflicted with the virus and they don't know.
yeah,
I found it today again.
yeah,
And bad too.
yeah.
They're having pains in their chest, they say. I'm having chest pains, and I'm
Mhm.
going to the doctor wherever they went, and they say that everything is okay. But they're not testing them, they're not checking for that. Most places are not checking for it.
No, because it don't relate it to any problem that
They don't link it to the
person having.
problems.
Uh,
You know,
um,
um, if you come to me with a chest pain, I'm going to also check your lungs,
yeah,
because the lung is behind the chest, the wall of your chest there.
yeah.
Not only the heart, your stomach is there too.
A lot of people when they come They don't tell you, many times they don't really tell you that they have a problem with cold or with anything. But then I screen them, I can look and see the nasal cavities and the sinuses is congested. And that's the first thing I can see. Of course, the lungs are congested too. And then the trachea is congested. So I would turn to tell them, hey, do you have a dry cough? Yeah, I do. I forgot to tell you that.
Mm-hmm.
Are you coughing and nothing coming up? Yeah, yeah. And you have a problem at night? Yeah, I do. I can't breathe because I can see it. You know.
Yes. Yeah.
I said, you 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 have COVID? No. Yeah, you do.
First you should know that thing's still wrong.
What? No, I had the shots. I had all the shots.
Mm-hmm, mm-hmm.
I had them all. I took them all. I took everything. Yeah, you have COVID. But I was wondering how come I can't, this cough has been with me for many years. I can't get rid of it. And my nose, every night I go to sleep. Coronavirus. You know, and that will lead to a lot of other things, you know.
Of course.
And if you've had the shots, then we have to look and see whether or not, you know, you have any problems with the immune system. Obviously, that thing, it shows up. Number 6 shows up. Definitely. Sometimes this number is the first thing on top.
Yeah.
And that deal number 6, the system that deals with the immune system. Once the immune system shows up weak, then a whole host of other things.
Exactly. Today I had someone who was for the first time made aware as to all of what is in the vaccine.
Really?
Yeah. And she was very angry because she said she was forced to take it.
Yeah, a lot of people were.
Yeah, she didn't want to take it, but she was forced to take it.
A lot of people were.
Because there was so much scrutiny that was occurring at the time.
Yeah.
That people were in doubt about, you know, who is telling the truth or not. But the truth revealed itself after, even long after, you know, it revealed, and people, it's too late. For many persons, it's too late. And we also finding that people are just falling dead. It happened in our community just today. Good, strong man. Nothing was wrong with him. He wasn't sick. He had a little heart condition, they say, but he just fell dead.
Yeah. Yeah. And 3 or 4 years ago, well, yeah, but no, 3 or 4 years ago, that was a very common thing.
Yes.
And people were just, they were walking, and even athletes, you saw a lot of videos of that, right? Yeah. And they were having endocarditis, you know, pericarditis, you know, problems with the heart. And a lot of times, most of them were vaccinated to the tilt.
Yeah, all the booster shots, everything.
All the boosters and everything else.
It's really sad, man, really sad. But getting back to cancer, I mean, there's not much that we can do. We're trying our best to help persons to get their immune systems up, which is very important. Because without an immune system, anything can happen to you. You know, so we are reinforcing that immune factor, that you need to focus on building your immune system, because it's the only thing that can protect you is your immune system.
Yeah.
And getting back to what we consume today, much of what we're eating today are chemicalized.
Mm-hmm.
They're highly chemicalized, and they contain a lot of metals that are even further hurting our bodies.
Yep. And a lot of chemicals like dioxin, PCB.
Yeah, it's all in
polycyclic PAH.
I got a whole host of information that
aromatic hydrocarbons, things like that. Yeah.
It's really, you know, we are really in serious times. You know, in perilous times, and I'm saying to people, grow your own foods. Grow your own foods. If you come where I am now, you're going to see callaloo in the backyard. You're going to see thyme. You're going to see, you know, I try very hard to even ginger I have in the backyard.
That's good.
You know.
No, I started to. I really did.
And the thing is, there's concrete on the ground.
Oh, wow.
I don't have the soil in the ground to plant it. So what did I do? I put them in the pots.
Yeah.
So I'm saying to people, you can grow your produce in pots, in tires. You can, even if it's concrete, you put the tires down, the tires, wasted tires all over the place. You put
You,
them down and you put soil inside
you
as
put
much
the
as you
soil
can.
and fill it.
And you plant the foods that don't require deep roots.
Mm-hmm.
You know, you can plant a lot of it. You can plant okra, you can plant
Yeah, a
pak choi,
lot of vegetables.
ryla, you
Yeah.
can plant pretty much all the vegetables.
Yeah.
So don't give me the excuse that, oh, my concrete is my yard is concrete or whatever. You know, I was looking also the factor that contributes to parasites, and it's dogs.
Yeah. Animals.
People don't realize that when they play up with these dogs, when they kiss these dogs, they don't even know what the dog has.
Mm-hmm.
And that is also an instrument that contributes to parasites and worms.
Mm-hmm.
When a dog mess, if you really look at it, if you open it up, you'll see worms in there. You know, so you think that it's. I mean, I don't have anything against dogs, but I wouldn't own one.
Well, you get to own a lot of them.
I used to own them indeed.
But no, what changed when
Now
you
that
see
I
what
know
happened?
what changes, what I learned.
Yeah. Yeah.
I didn't know then. I was ignorant of what they carry, what was happening with them.
Mm-hmm.
You know, and the people who have the dogs in the homes, they're breathing the same air the dog breathes, in and out.
Mm-hmm.
You know, they're actually. I mean, it's crazy. For us, for me, if you have a dog, he belongs outside, not in the house, not in my house. You know, as a matter of fact, if you have a dog in your house, I'm not eating from you. No, I'm not.
Yeah.
You could be my
You
own child.
you might find out later on afterwards that the dog was there after you.
You know that. But you know what is funny though, right? This is no joke. Dogs have an odor.
Yeah.
People don't realize it because they're living with the dog.
Yeah.
Dogs have an odor, and if you're not used to that odor, when you walk in there, you pick it up right away.
Yeah. And the dog would tell you and I, you all have an odor. Yeah, everybody has a different smell. That's why dogs they can detect. They take them, they train them, and they can find anybody anywhere.
but you know, we making it's not really funny, right? But we laughing. But it's good. Laughter is best medicine too.
Yeah.
But people need to be very careful and cautious, and they need to be more responsible to themselves, for themselves. The average person is not. The average person knows nothing about detoxifying their bodies. They don't even think about deworming.
Yeah.
You know, I suggest to the folks who come to our doors, the patients I see all over, says, listen, if you're consuming dead matter, and I say dead matter because it is dead. I don't care if it's fish or chicken or beef or pork or goat, it's dead. You know, it is dead before you eat it. It's dead before you cook it.
Yeah.
If you're consuming dead matter, you need to detoxify yourself at least twice per month. At least twice per month. To remove the matter that is in your system that you may have absorbed that is of a toxic nature. The average person who consumes the dead, when they pass gas, you can't be around them.
Mm.
It smells terrible.
Toxic.
Very toxic.
Oh.
Why do you think it is toxic? It's toxic because it's something that's dead that you now try to process, that it became more dead.
Mm.
You know, so it didn't come out of your system fast enough. So what happened? It putrefied in your system, rotted, and now when you go to the toilet, it's difficult to come behind you. You have to hold your breath. It happens. I mean, I travel a lot, and it happens at the airport a lot. You use the toilet, and you go in there, and you know there's somebody in there that you know, had a bad diet.
A bad diet.
You know?
Yeah, to battle all cancers. I'm relating to the China study, and the doctor was asked. They were informing him about different cancers and different things, and he kept telling them, giving them the same answer. You know, uh, most of all the cancers, all of them are caused because of animal products.
Wow.
And in order to get rid of all the cancers, because we've done this China study is very extensive, very, very extensive study. It took many years, and it cost a whole lot. And he was saying that the solution to the problem is so simple that when you tell the people that you have to change your diet, get off of animal products, stop eating all the flesh meats, get off of dairy, and whatever cancer you have, uh, it's going to take care of itself. Just change your diet.
Mm-hmm.
I said, but that's the answer to every, colon cancer. Change your diet.
Of course, you think about colon cancer.
Breast cancer.
Where that food is going when you eat it.
Yeah. So people were expecting. They're expecting, because so much money is being gone into research, and they do find genetic and all the different information relative to these particular cancers. However, when you go and you look at the whole report, they fully don't understand the cause.
Yes.
But they can see certain markers, and the ones that I mentioned before. But that does not necessarily mean that's the reason why. And what they're saying, because this is the reason why I'm brought this up, because he had one parent call him one night, a mother, and she said, I have a problem, I have a dilemma. And he said, what's the dilemma? I have breast cancer in my family. I've had it. My aunts have had it. My mother had it. And all these other people in my family, most of the women have had a bout with it. Now I have this young girl, my daughter, I'm thinking maybe I should not have her go through the process. I'm thinking about having her go and get a radical mastectomy.
Yes, it is happening a lot.
And oophorectomy, get out the ovaries, get out the breast, and all these things. I'm trying to make a decision to do that. I don't want her to go through the whole process of having to deal with chemotherapy. And I wanted to call you to get some advice as to whether or not I should allow her to go get the surgery. And they spoke for, he said, about a half an hour. And all he told her was, if she changed her diet, it will take care of the problem. And he said, his comment was, she was hoping that he would give her some big explanation. And he sensed that she really wasn't fully, accepted what he was saying. But based on the research that he's been affiliated with, doesn't matter what cancer you have, if you get off of all flesh foods, get off of all dairy, and then use a whole food plant-based diet, all these things disappear. Just change your diet. I mean, she's a young girl. She hasn't had the BRCA1, BRCA2 genes. Genetically, yes, she has it, but it doesn't necessarily mean that she's going to develop cancer.
Yeah.
It's there. It's a potential problem, but if you're able to change your diet, more than likely it would not be. Most definitely. And he said it was too simple an answer.
It was too simple an answer.
Yeah.
For her to accept it. See,
Yeah.
but it's the real answer.
Yeah.
You change your diet. You detoxify yourself to remove what is already stored. You see, people don't understand that when you eat these dead matters, you think it just goes in your system and come out when you defecate?
No.
No. Once you digest it, you're absorbing everything that's in it,
Mm-hmm.
including the diseases that the animal might have had.
Yeah.
You see? And your body got to deal with that. Your body has to try to process that.
Mm-hmm.
It's sad. We put our bodies through a lot, you know. We put our organs through a lot of stress. A lot of stress.
Yeah. A lot of times it's in ignorance, because we're not really fully aware as to what's really involved.
Yeah.
And we are so conditioned and trained to believe that, or to get information that we don't fully understand, and use it, because it's way beyond our knowledge base, and we have confidence in the people who bring it to us that is able to, they're able to, whatever they bring in is able to help. But I tell people at times all of it has to do with your diet. All of it.
Yeah.
You may have genetic predisposition for a lot of things. It does, if you follow the same, and you have the same lifestyle as your father, your mother, whoever had the cancer, then sure enough you're going to develop it.
I was going to go down that line to explain the genealogy theory, the DNA theory, how it transfers from one generation to the next. You know, if you grow up with great grandmother, and great grandmother is cooking and eating a certain way, and great grandmother teaches grandmother the same thing. Great grandmother is struck by some type of disease, might not be cancer, but some disease that came out of the dietary system, and you continue to go down the same path, you will end up with the same thing. And as grandmother teaches mother ends up with the same thing. And the children end up with the same thing. So it is transferred from generation to generation more of the time because of the dietary things that what we consume, where we're exposed to, the chemicals we are exposed to, the habits that we have, smoking, drinking alcohol. You out there, you're just doing the things, barbecuing flesh and eating it. We dig our graves with our teeth, and we eat ourselves into our graves. I've been saying that for years now. Years. We say donkey years. I've been using that phrase for long years. Since I started doing our programs on television since 1996. We need to stop. If we stop digging our graves with our teeth, we would have less funerals to attend, because we would not be eating ourselves into our graves. We will have less family members to bury so early in life. The cancer factor is not occurring only when you age anymore. We knew back in the days when we were growing up that if somebody get cancer, it's somebody that is very elder, an aged person.
Right. But now it's different.
There's no age with cancer anymore.
No, young people have it.
Yeah, there's no age anymore.
And it's related to all the things that transpired 3 years ago. So many things happened 3 years ago. It's really put people at risk.
Yes. Yeah.
And you can't turn it back. I mean, you can't change the course. Well, you can if you try. You got to mediate problems. Like you said, you got to clean the system, detox, get rid of things. And turn away from the lifestyle, the dietary lifestyle that you're experiencing right now, because that's what's causing part of the problem right there, or maybe all of it. And try to change your eating habits. And there's some people who don't have any problems. We're talking to a group of people who don't have anything going on.
Yes.
But they haven't gone to check a doctor in years. They'd be the first one to tell you that they never get sick.
Yeah.
But then they're the first ones, usually the ones that you say, what happened? You ask about them and say, oh, he died. What? What happened? You don't know. He was never sick.
Never sick, and all of a sudden he's gone.
Gone.
That means that
When
he
it,
was sick and he had no idea he was sick.
oh, I did. And we used to see a lot of those. Those are the autopsies we used to have to do because they don't have any
No history.
no history of anything.
Yeah.
And we want to rule out some history. We want to rule out foul play and things like that. So we have to know the cause of that and the manner of that. Whether or not it's suicide or homicide or whatever. I never used to like those cases
I
because
know.
you have to do everything. You have to check everything.
Everything, because you have no clue. There's
You have
no
you have
clues
no
that would lead
history.
you anywhere.
Right. But then when you do open and you look, you say, oh my goodness, this guy had cancer. He didn't know that.
Yes. I have the firm belief that there are some people who commit suicide because they're very sick and they don't want anybody to know.
Well, that's another thing too. That,
I am a firm believer of that there are people who commit suicide because they would have been sick and they didn't want to tell anyone.
that's another thing.
That's another scenario.
That's
Yeah.
And that one, when people do, and those are cases too, we have to look into because you
Of
don't
course.
you don't know the
Because
cause
the
of death.
suicide doesn't mean that is the cause of death.
Yeah, you got to know what
That may be the end result, but
yeah.
the real cause is probably beyond, the act. Like I would use the scenario of this guy who I knew him very well. That whenever I go to clear the medicines or so, I would see him, and he's always sweating. So I said to him, I said, boy, you need to get yourself checked, and I'm willing to check you at no cost. Come. Why are you sweating like that? He said, Doc, I don't know, but I'm always sweating, man. I said, it's not normal. I mean, it's not to be like that. Are you suffering with anything? He said, yeah, I got some pressure problems, but that's what's happening. I said, more reasons why you need to get screened, because if you have pressure problems and you're sweating so bad, something is under stress.
Right.
So he said, come one day, right? So one day, I got a call one morning early. I got a call from a friend of mine who works with him or used to work with him. And he says, Doc, you remember this guy? I said, yeah, of course. And I was just talking to him the other day. He said, well, this morning the man died.
Oh.
The man died. I said, what do you mean he died? He says, yeah, the man died. Just like that, he died. Cardiac arrest.
Yeah.
So you don't take things, your body sends messages out and you need to be conscious of those messages. Get yourself checked, come to the clinic, let us screen you because we'll find it. If the average physician don't know what it is, we'll find it. You may not believe it, but we'll find it.
Mm-hmm.
There hardly is anything that we don't find in there. Hardly. If it's there, we'll find it. If they understand the philosophy behind what we do, they'll know that we'll find it.
Mm-hmm.
So don't be afraid. If you want to know if you have cancer, if you want to know if your cancer cells are activated and they're, don't wait until you have a lump or you're feeling a discomfort or you're bleeding rectally or, get yourself screened, make an appointment, call the number, make an appointment and get yourself screened because you never know what it is.
Never know.
At least you need to know why.
Yeah. If you see something's happening and you consistently see it, and you're concerned about it every time you see it, when you don't see it, you're not concerned, but when you see it, you're concerned. You need to check it out.
Check it out. Get yourself looked at. Don't wait until I would also say that the best time for you to check your physician is when you're well.
Yeah. Well,
don't wait until you're sick because when you're sick, it's pretty much far gone. It happened already.
Yeah, preventative care.
Go into a healing mode. You have to take your body down the path of removing the causes, and then you got to get the body to heal itself. It's more costly to do that. Get yourself checked when you're not sick.
Yeah.
Because you want to make sure there's nothing threatening you that you don't know about.
Right. Exactly. Preventative care is very, very important, and it's cheaper. It allows us to see exactly if you're in the pathway towards something. You can always deviate and change that.
Yeah.
Yeah.
Don't wait until it's too late.
Yeah. And a lot of smart people that come all the time and they do that, you know, to see exactly what's going on with the system.
Oh yeah.
And if people that own very, very expensive cars, they hear something, they'll take it to the mechanic, right?
Exactly.
So, hey,
Exactly.
I heard something. I never heard that before.
Yeah.
People maintain their cars better than they maintain their bodies.
Even the bicycles.
Oh, bicycles too. Wow.
Yeah.
Yeah.
And they maintain their bicycles, their motorcycles, their cars, their
Yeah.
vehicles better than they maintain themselves.
And that's, we need to treat our bodies like that. You don't wait until everything breaks down and then come. You know, we will work with you, but it's
It's
you
it's a
know
lot. It's a lot of work.
it's a lot and it costs more because there's a
Also,
whole lot of other systems going.
exactly.
You
You know,
we
I,
have to do.
I think sometimes people don't take into consideration the fact that if your breast has cancer in it, if it's detected that your breast is cancerous, that cancer is not just at your breast, you know. It's not just there. That is where it manifested. But your breast is part of a body system.
Yeah, I
It's
mean,
part of the same system.
yeah, it's part of your jungle system. So what's there? Let's see. You have the ovaries. Your ovaries are there. Your uterus
The
is there. Your
cervix.
cervix is there. I mean, it's a closed system, but other things affect it outside of it too. You know.
Worse.
And speaking about breast cancer, I mean, it's not just limited to women. Men can get it too.
Of course.
You know.
Of
Um,
course. We had a study that was done, not Cali, that I think it was in Mexico or somewhere, where the guys were getting a lot of breast cancer and they couldn't figure out why. And they were having boobs like women.
yeah, and that's the thing, because what they're finding out with this, the HER1 and 2 genes and the BRCA genes, if they're familial, it doesn't matter. It's not only limited to women; it's limited to everybody in the family,
Just matter
male
of the
too.
gender. Yeah.
Yeah, and I think Beyonce, her father was talking about breast cancer. He was diagnosed with breast cancer. The BRCA gene 1 and 2 was in his family. His mother, his siblings, and so forth. They were all having it. And then he found one day, he got up, and he was noticing that his breast was bleeding.
Wow.
Yeah, blood coming out from the nipples, a lot of blood. So he went and checked it out, and sure enough, he had breast cancer. You
Look at
know,
that.
and he had to have a mastectomy, remove all the. Men don't have the same breast
See, makeup.
mass,
Mhm.
right? The mass of the woman, but so they had to remove that whole area, uh, remove the cancer cells from there, plus lymphatics and things like that. And it's not limited to women, men too. So
No, it's not limited to women. It's not limited to that particular organ.
no,
And it hasn't,
all of
most times it hadn't started there.
yeah,
Most times it didn't start there. Something happened and it ended up there. And what we do is to find out what happened. In our work, we were able to trace pretty much those genes, those cells, and identify where else they might be. Where else they're active. We can do that. We do it all the time. Where else they're active. And then
yeah,
you could take action to actually try to destroy them, let the body destroy them, because we can't destroy them. We can only provide mechanisms to help the body to destroy it, to
right,
destroy them.
right.
But it's important that you screen and screen early. Don't wait until something is gone far or is bad.
No, no, that's a bad move. But then if you're in that situation where you need help and you waited too long, still come.
Yes,
No
come.
time like the present. You know, no time like the present. And people don't. A lot of times they don't want chemotherapy. They don't want radiation therapy. They
Yeah,
don't want anything.
yeah.
You know. There are people who already got a diagnosis and they don't know what to do. You know.
Well, they can visit our clinic there at in Kitty. Call the number, make an appointment, and we'll screen you. We'll educate you. We'll put you in a path where you can, follow our protocol to help yourself to be able to overcome it, because you can overcome it. We've helped a number of persons overcome it over the years. So many people. I got the records, but you can overcome it.
Yeah.
I overcame it. And if I could overcome that, anyone else can. So they talk about breast cancer survival. I mean, there are people who survive cancer totally, not just breast, colon, prostate, colorectal, liver cancer, pancreatic cancer. How would a person, when you think of it, how would a human develop pancreatic cancer if it wasn't linked to what he's exposed to? Nutritional wise, chemical wise. It had to be linked to something. So the China study is not out of order. It's in order.
Oh yeah.
If we correct what we put in our bodies, we can change a lot of what happens to our bodies.
Oh yeah, and it's the key and the solution to all the cancers, and the information is there. The numbers are there.
Do your research. Check the China study out yourself.
Yeah.
Go online and check it. It's there.
There, and information is there, and it's amazing. We have so much available to us,
but yet still we don't utilize it.
Right. We don't
check the factors that are linked to cancer when it comes to worms and parasites.
Yeah.
Check it yourself.
It's there.
It's there. Check the chemicals. It's there. The cadmium, the mercury, the lead. Check it. It's all there. I have a whole host of things that I wanted to talk about today, but we didn't get a chance to really get into it. But we will. This entire month we're going to spend discussing cancer.
Oh, yeah.
And it's not just about breast cancer. It's about cancer in general. Prostate cancer.
All cancers.
Lung cancer. Everything.
All
Cancer is an enemy that needs to be stopped.
Yeah,
the cancer needs to be assassinated. If nothing else needs to be assassinated, we need to assassinate cancer, because each individual doing the right thing can do it.
Yeah, it's your diet, man. Your diet.
The weapon is your teeth, your tongue.
The weapon is your teeth and what you eat.
Exactly.
Yeah.
Exactly. We need to stop digging our graves with our teeth and eating ourselves into our graves. But Dr. Richard, guess what? Time is up.
Oh, we just started.
Time is up. You believe an hour is already gone? I don't think so.
Yeah.
It doesn't seem like an hour is gone, but the guy said 7:15 and it's now 7:17.
Yeah, you're all the time. Yeah, but it's
we're gonna continue this dialogue with cancer, and I have a whole host of information that I want to pass on, and I just wish that people would tune in and forward that information to the folks who they know.
Yeah.
Join us, sign on. Just put Dr. Joseph Haynes on YouTube and it'll come up, and you just log in and you'll go. Just share it, spread it, because you never know where it's going to hit in your family. And if you can get information that can help you to at least save one, it makes a difference. So any final words?
Yeah, I mean, listen, what we're telling you is key to, if you have cancer, it is key to your situation. Change your diet. If you don't know how to do it, just come in and visit us. We'll help you, get you in the way, assess everything that's going on in your body. You may just have thinking about that one cancer and that one area that you have a problem, but it might be other places too that you have to deal with. So just come in and get a screen. We can get you on the right track, on the right path, with your diet and everything else.
All right, Dr. Richard, thank you. The number to call is 231-6477, or just call Safe TV Channel 2, and they'll give you the data so you can at least get a hold of us. And you never know, the life that you save may be your own.
That's right.
May very well be your own. Don't take it for granted. Follow us. We have information that we're going to pass on to you, pertinent, legitimate information, and we have methodologies that can change what is happening with your life. I've been doing this now since 1993. Since 93.
Yeah,
that's a long time. It's 31 years.
Long time.
Yeah. So Dr. Richard, thank you very much for your participation.
Thanks for the invite.
We appreciate it, and I know that the world appreciates it. And we're going to continue down the path of trying to provide information that can at least affect people's lives positively. So thank you once again. Until we catch up again, you take care of yourself and be safe.
Okay.
All right. Goodbye, folks. So long. It's done, man.
If you or someone you know is sick, have tried to get help and is not feeling any better, then call or visit the Health and Wellness Center, where we will screen your entire body and find your problem and treat you so that your body will overcome your illness. So visit us today, 72 Queen Street, Kitty, or call us at 231-6477 for further information.